Hello everyone, good afternoon and Assalamualaikum. Thank you so much for being with us again today. Today we will be talking about colon cancer. This is a very prevalent type of cancer in Malaysia. In fact, it's one of the main killers lah, yeah. So in order for us to talk about this, we have an expert here with us. He is the Consultant General and Colorectal Surgeon from Columbia Asia Hospital, Venayagamurthy Kanisan. Welcome, doctor.
Thank you.
How are you?
Fine.
Okay,
Fine.
that's good. How shall I address you?
I'm Dr. Vinay.
Dr. Vinay, okay, all right. So back to the topic, we're going to be talking about colon cancer. Atau is it colorectal cancer? Which is the right term? Because I hear these two being interchangeably used.
Colorectal cancer.
Okay, all right.
I'll explain later.
Okay, all right. So we'll see that. Okay, maybe first and foremost, you can describe exactly what is colon cancer. I understand you've got some slides as well. Okay, here we are. Colorectal cancer. Okay, all yours, doctor.
First of all, thank you for hosting me today, Madam Chairman. So, as we all know, next month is the colon cancer month worldwide. So, because of that, I would like to present this topic to all the Malaysian people out there.
Yeah.
So, we need more awareness about colorectal cancer.
Yeah.
Okay, because early detection can cure the disease. So if you look at this picture, this is basically the organ that we are talking about. This is the colon. Okay, this is colon. This is in the abdomen atau in perut in Malay.
Yeah.
So the organ is in the abdomen. Start from the right side here, goes up, cross over to the left side, comes down, and goes all the way down to the anus, where we pass motion every day. So this part is what we call colon. Okay, and
that whole length.
Yeah, the full length is
the
colon.
Entire length. Okay.
And the straight organ here is called the rectum.
Okay.
Rectum means straight in literally straight.
Yeah.
So for us as a colorectal surgeon, we tend to differentiate to do these two organs. This is colon, this is rectum. But for the general population, we can take this as one organ, colon and rectum.
I see. Okay.
So next. So these are some of the pictures of the colon cancer. If you look at here, the cancer can be like ulcerating type, or sometimes can be like a big mass, like a polyp tumor type. So it can have different picture grossly.
Doctor, what we are looking at now, this is a cancer that has been around for how long? So I mean, this looks.
This has been there for years, maybe 2-3 years, or even 1 year, or up to 5 years. So these are some of the patients that we have resected out the tumor. So these are the pictures of the tumor that we have resected.
Will this be stage 4? Is this considered stage 4?
Not yet. Depends.
What
will happen after we resect the tumor? We will send to the lab, the pathology lab, and they will slice the tumor. Look under the microscope, and then only finally we can know the stage of the tumor. So from the naked eye, we cannot tell for sure at what stage the tumor is.
Okay, because when you're talking about stages of cancer, it's not about the way it looks, right?
Not the way it looks. The way that we can detect it microscopically.
Okay.
By the pathology. Yeah. Okay. Next.
Great. Okay, let's take a look at the next slide.
So something about the epidemiology. Colon cancer is the third most common cause of cancer death worldwide, after breast and cervix cancer in females. But in male, it is the #1 cause of death. Okay. And according to the WHO report, 1 in 33 Malaysians are at risk of developing colorectal cancer. And generally, it is higher among the Chinese ethnic groups and those above 50 years old.
Doctor, why is it, in your opinion, why is it more prevalent among the Chinese population? Is there a reason for that? Maybe diet,
Basically,
lifestyle?
a genetic reason.
Oh, I see. I see. Okay. And that figure just now, because that's a global figure. In Malaysia, what is the what's the prevalence figure?
These figures are actually from the Malaysia. The figures were taken from the National Cancer Patient Registry, but
I
up to the
see.
year 2013. So these figures are Malaysian figures.
Okay. Let me summarize that again. You mean to say that colon cancer is the number 3 killer among females after breast cancer and
Cervix
cardio
and cervix
and
cancer.
cervix? Okay. After breast cancer and cervix. Okay. And among males, it is the number 1.
Number one, um, after sometime lung cancer and prostate cancer are among the highest. So it's lung, prostate, and colon cancer. These are the main killers among males.
Okay. All right. Okay. What is this about? Incidence 21.3. Wow, that's a lot of numbers we're looking at.
The incidence is around 21 cases per 100,000 population,
Mm-hmm.
slightly higher among males, slightly higher
Okay.
among Chinese, and
Okay.
the mortality is around 9.8 cases per 100,000. These are some of
Okay.
the statistics that I want to share.
Yeah. Yeah. Thank you so much. Yeah. The male-female ratio, is there a reason for that or it's just fluke?
It's just the genetic factor, but no particular reason why it's slightly higher
Yeah.
than males
Yeah. Okay. So this is figures for in Malaysia, yeah?
in Malaysia. Yeah.
Okay. All right. Let's take a look at the next slide then.
So
Sting.
generally, it is considered an old age people's disease, like more than 50, 60 years old.
Yeah.
But unfortunately, recently the age group is becoming younger and younger. So that means that those who are 40 years old, 30 years old are getting the cancer already. It's no more an
I
old
see.
age group people's disease.
Yeah. Yeah.
And they tend to have a lot of comorbids like diabetes,
Right.
hypertension,
Right. Okay.
hypercholesterolemia, and
Mm.
also family history lah. Okay.
Okay. That looks pretty low actually. 6.4%. This is chances of getting colon cancer?
The family history, if let's say you have a family history of colon cancer, for
Yeah.
example, parents or siblings, you
Mm.
are higher chance. But if you take the whole of the colon cancer cases,
Yeah.
not many of them family history. So it just shows, even though you don't have a family history,
Mm.
you're still at a higher risk to get the colon
Okay.
cancer. Uh,
Okay.
so doesn't mean there is nobody in the family with cancer.
Mm.
You cannot get the
Yeah.
cancer. You still can
Right.
get the cancer.
I see. Okay. So this is why we're talking about this topic today. It's not just about family history. Got it,
Yes.
doctor. Okay. What are we looking at next?
Um, so this some statistic also. The Malay around 40%, Chinese 40%, and others around 10%.
Yeah.
And if you remember the diagram I showed you just now, the left side of the colon are more prone
Yeah.
to get cancer. The left
Why
side
is
and
that?
the rectum. Uh, Probably because the feces, najis, tend to be
Yeah.
more concentrated on the left side of the colon.
I see. I see. Okay.
So
All
more
right.
exposure to toxins lah on the left side. Uh,
So if you're
and
constipated, that means you've got more chances of getting colon cancer lah. Dia
yeah, more
tak
risk.
gerak kan?
Yeah,
Yeah. I
one
see.
of the risk
Okay.
factors lah.
Yeah. Doctor,
And
sorry, looking at this, the list of races, you mentioned just now, I thought, wasn't it like the Chinese population are more at risk of getting cancer than Malaysian Indians?
they
Because it
are
looks here, the
relatively.
Malays have got a higher percentage.
This is because in Malaysia the majority population are Malays, so
I
statistically
see.
it's
Okay.
more.
Yeah.
But population Chinese maybe 20%, but 40% get the colon. So relatively higher lah.
I see. Okay, right. Yep, makes sense. Okay.
Okay, and maybe you can go to the next slide.
Doctor, sorry, because what does that mean just now? Smokers. Sorry, can we just take a look at the previous slide? Okay, this one,
So
the percentages is
smoking is one of the risk factors lah to develop the colon cancer. But
okay.
even that, the non-smokers still get the cancers.
Yeah, higher
So,
than active smokers. So that sounds very strange, because usually if you're a smoker, chances are you would be more at risk of these chronic diseases. But looking
yeah,
at this, the percentage is higher among non-smokers.
because there are a lot of other risk factors that come in. Let's say you are a non-smoker,
Yeah.
there is a less chance for you to get lung cancer, but still a higher chance to get a colon cancer, because other factors like genetics and dietary
Yes.
factors play a role as well. Which
Yeah.
I'll explain shortly.
Wow, there's no way out. I mean, if you smoke, if you don't smoke, you still
It's still going to
it
get it.
happens. Yeah, this is facts. Okay, let's take a look at the next slide. Thank you, doctor.
So these are the common presentation. The first, the commonest presentation is we call altered bowel habit. Altered
Okay, what is that?
bowel habit basically means any change from your normal bowel habit. Let's say you are going to the toilet once daily
Yeah.
or twice daily. That is normal for you for the past many years.
Yeah.
And all of a sudden now you have to go to the toilet 4 times a day. You're having a loose stool for no reason,
Yeah.
then you must seek the medical attention.
Mm-mm.
Or suddenly you are constipated, you cannot pass motion for 1 week, 5 days. So when something is not normal for you, then better seek the doctor's advice lah.
Okay.
Because that's the commonest way how the colon cancer present actually.
All right.
Okay. Another common way is blood in stool.
Mm.
Because when the stool passes through the cancer, the blood from the cancer sticks on the stool, and when they pass motion, we can see blood on the toilet bowl or on the stool. So this is
Okay.
another common presentation.
Okay.
And others just an abdominal pain, very non-specific pain, and people just assume it's gastritis, very common among our population, and then they
Right.
take gastric medication, but the pain is still not resolving.
Yeah.
Better get medical advice. Okay.
Attention. Yeah.
And another common one in Malaysia is weight loss. Let's say we used to be 70 kilo, 80 kilo, and we are
Yeah.
not even dieting, and there's a sudden loss of weight. Within 2 months, 3 months, we lose 5 kg, 10 kg, 20 kg for no reason. Then we should get advice.
Right.
Another one is anemia. Anemia means the hemoglobin or the blood is not enough in our body.
Okay.
This commonly happens more on the right side colonic cancer. Okay, let's say we do a blood test, your blood level is low, 7, 8, should be more than 10, then we
Yeah.
must get doctor's advice.
I see.
And,
Okay.
and some of the cancers, they present on the late stage because the tumor is so big or constricted that the bowel become obstructed.
Right.
So they present with a bowel obstruction, tummy distended, vomiting, unable to eat. This is the emergency presentation, and commonly at this stage, it already advanced stage of the cancer.
Okay. Doctor, if any patient presents these symptoms, would this all occur at the same time? Or would this all happen
Not all of them, they may have
together?
maybe just one of the symptoms.
One or
So
two?
if you just have one symptom, then it is advisable to see the doctor.
Oh, I see. Okay, so any one of this that happens to you, then you just have to go and seek medical attention.
Yes, yes.
Okay. But what if, for example, if somebody gets abdominal pain, which sounds like something very common, and they don't seek medical attention because they might think that it's just sakit perut biasa, So what what can you say to those people who don't feel that it's important enough for them to go to the hospital just because they have one of these symptoms?
You can go to the clinic first, see the GP doctor. You can still try the normal medication, whatever the GP doctor prescribes.
Yeah.
Maybe
Yeah.
gastric medicine, painkiller, whatnot.
Right.
If it is responding, then it's okay. They say one episode of pain is not so worrying. But let's say
Yeah.
the
Yeah.
pain
That's right.
keeps coming back, it's not resolving. Even after taking medication, then you must seek further advice.
Specialist consultation.
Yes, yes.
I see. Okay. All right. Any more? Are we looking at any more symptoms?
Can go to the next slide.
Wow. What is this?
This is just to show the how bad the tumor can be. Let's say we detect the tumor early, it can be a T1. T1 means that it is the still early stage tumor, which is, I can say, a good tumor lah. This is curable. So if we
Okay.
wait too long, it becomes a T2, T3, T4. That means it penetrates deeper and deeper into the colonic wall.
Okay.
So the deeper it penetrates into the colonic wall, the outcome is worse. So the trick is to detect the cancer early.
Yeah. Of course.
Maybe
Yeah.
the T1 stage.
What is that, doctor? The one that looks like epidermis. It looks like a cross section of skin.
This is actually the cross section of the bowel wall.
Oh, I see.
This is the cross section of the bowel wall. The innermost layer is called the mucosa.
All
And
right.
the outermost layer, we call it the serosa. So the
Okay.
tumor starts from the mucosa and then spreads outwards towards the serosa.
The tumor will start. You mean in the innermost, the last layer,
The
the innermost
innermost
layer
layer.
of the colon.
It starts from the innermost layer and then
Okay.
spread outwards to the outermost layer.
I see.
So the deeper you spread, the outcome is poorer.
Okay, doctor, if we are talking about detection of colon cancer or the tumor, how can we tell that it's in there if it is not protruding like a polyps kind, for example, because it's way in the inside, and we want to detect this early so that there is chances of survival lah.
Yes,
You know what I
yes.
mean? Like then how do you detect that it is in there? Is there a way for us to tell that there is cancer growing before it actually is visible?
That is why we need first have to see the doctor early. The earliest signs of earlier symptom must take a doctor's advice.
Yeah.
Number two is we can do screening. Screening
Okay.
means even though we got no symptoms, we can still go for checkup. The reason being, sometimes the symptom develop and the cancer already at the advanced stage. So by
Yeah, yeah.
doing screening, even though we got no symptoms,
Yeah.
we go and check out, we may detect an early cancer.
Yeah.
So one way is by screening.
And these screenings are available at Columbia Asia Hospital, Cheras?
It is available. I got some slides later towards the end, which I can show
Okay,
you the
that's good.
types of the
All right, yeah,
screening.
we'll go through that.
Okay. So as I mentioned just now, the spread is from the inner layer to the outer layer. So once it spread to the outer layer, it also goes to the bloodstream, the lymphatic drainage, and to the surrounding what we call lymph nodes. So if the cancer spread to the lymph nodes, is already an advanced stage of the disease. Worse still if it spreads to the other organs. For example, spreads to the liver, to the lung, to the brain, to the bone. It is already an advanced disease lah. So we didn't want to go to that stage.
All right.
All right.
What's next?
So in Malaysia, if you see the statistics, Most our patients present at T3, T4, which is a more advanced level. So it's around 80% of them. So, which is not a good thing as far as we are concerned, because the more advanced present, the survival is less. So our aim should be, we should be able to detect the disease at stage 1 and stage 2 level. So if you look at this, if you detect the tumor at stage 1, the survival is excellent, around 90% up to 5 years. So the higher the stage, the survival rate goes down. Like stage 4 and spread to other organs, the survival very poor, 15%. So at the moment, the Malaysians are still presenting later at stage 3 and above. So probably if you detect the cancer early, the chances of survival is higher.
Yeah. Well, why do you think Malaysians come in late to talk to a doctor or to come for screening late, and then you find out that
Yes,
it's
that
already.
the awareness about the symptoms is less. It's not there. So when they have the
Yeah.
symptoms,
Mm.
they don't seek doctors' advice.
Okay.
So maybe if we can spread the awareness among our population, then
Yeah.
they'll be more forthcoming and we can detect the cancer at the earlier stage.
Okay. Doctor, another thing I'd like to ask you, when you're talking about survival rates, right? 5 year survival. So that means if you are suffering from cancer at stage 4, there is only a 50% chance of you being alive. I mean, sorry, not to sound so morbid lah. Being alive in the next 5 years. Is that what you mean?
Yes,
So,
yes, correct. Yeah, correct.
okay. Okay. All right. Just wanted to clarify that. Okay. What's next?
So maybe we can move to the next slide.
Mm.
So these are some of the risk factors of developing colon cancer.
Okay.
First of all, family history. Let's say our parents, brothers, sisters, or even
Yeah.
uncle, aunties, grandparents have a history of colon cancer, then of course we are at a higher risk.
Yeah, of course.
Number two, dietary factors, low fiber diet. We are not taking enough vegetables, fruits.
Mm. Mm.
Fruits a lot of antioxidant, which
Yeah.
is anti-cancer. So we are not taking enough vegetable. Fruit is a higher risk
Yeah.
factor.
Right.
Age, of course, more than 50 years old.
Mm.
But nowadays, I would say even more than 40 years old already at a higher risk.
Yeah, that's true.
Yeah, and those who are taking a lot of high-fat diet, high
Mm.
cholesterol,
Yeah.
makan burger, McDonald's, KFC, a lot of fatty food.
Oops.
So the
Mm.
hyperlipidemia also higher risk factor,
Yeah.
smoking, obesity, a lot of
Right.
cholesterol in the body, even high blood sugar, high blood pressure, high lipids. If you look
Mm.
at this, it sounds like a risk factor for heart disease. But actually, whatever risk factor of heart disease is also risk factors for cancer as
Cancer.
well.
Yeah.
So colon cancer is become like a lifestyle disease nowadays.
Yeah. Doctor, if you can just point out like which of these would be like the top three lah. Okay, let's just say the top three risk factors that everyone should really be looking out for.
I would say family history,
Okay.
age more than 40 years old,
Mm.
and also low fiber diet lah. The first three.
Okay. Okay. So the low fiber diet, that one we can do something about it lah.
We can do
Let's
something
go
about it.
into
Family
yeah.
history and age, unfortunately.
Yeah, that's right.
we are
So at
doing-
least we can try to improve our diet lah. Okay, that's
yeah.
good to know. Thank you, doctor.
Yes.
What's next?
Next. So these are some of the pictures of those
Mm.
that consist the high risk factors,
Mm.
smoking and obesity, red meat, and all
Yeah.
these things. Next. So what is protective against cancer, colon cancer? high fiber, eat more vegetables and fruits because they contain
Yeah.
antioxidants. That is
Mm.
antioxidant or anti-cancer elements in the fruits
Yeah.
and vegetables.
Any particular fruits or vegetables, or just generally all?
It's generally any fruit and vegetables are good.
Okay. All right.
So if you have a family history,
Mm.
we have 2.5 times higher risk of getting the colon cancer,
Yeah.
and especially the younger your relative, the higher the risk factors.
Mm.
Let's say your sibling at 40 years old got the cancer,
Yeah.
then when you are 35 years old or 30 years old, it's about to do your checkup already because you're higher risk to get the cancer.
Okay. Doctor, in your experience, you've met a lot of patients, I'm sure, with colon cancer. How old is the youngest patient of colon cancer that you have come across?
Youngest 20 something years old.
Oh, wow.
In certain condition which is genetically related, there are
Mm.
even some teenagers with colon cancer. But I've seen even 20 plus years old, no risk factors in the
Mm.
family, no genetic reason,
Mm.
also can get colon cancer.
Random, huh? That can also
Randomly,
happen. I see.
that can also happen. Yeah.
Okay. Yeah, you don't know lah, these things. All. If it's
Yeah.
gonna happen, it will happen. Okay, let's move on from this.
So I just want to elaborate a little bit about the altered bowel habit, since this is the commonest
Okay.
symptom. So what we
Yeah.
mean by altered bowel habit is just means anything, almost mean anything, any change in
Mm.
the frequency of you going to toilet, you have a loose stool, constipated,
Yes.
you
Mm.
cannot control your motion,
Yeah.
or you see blood or mucus in the stool.
Yeah.
So any change, please go and see the doctor for further checkup.
Okay. All right. We'll do that.
So even in our fraternity, we even have a stool chart where
Yeah.
we categorize the shape of the stool. So
Okay.
if you look at that, the type 4, like a banana shape, that is the normal stool lah. Type 3 and type 4, that is the normal shape of the stool. So anything that is not from that,
Mm.
apart from that, for example, type 1, like the goat stool,
Yeah.
like small blood lumps, very constipated patients.
Mm.
So you have a type of stool, a type 1, type 2, or 5, 6, 7. 6, 7 is
Yeah.
like watery stool. Then we
Mm-mm.
must seek doctor's advice.
Yeah.
Uh, so once in a while, when you go to toilet, please take a look at the stool shape and size.
Yeah. Need to make a note of that. It may sound funny, but this is actually something that you need to make a note of. Seriously.
Yes, yes, yes. Thank you.
Yeah. See? Okay. Rectal bleeding. What is this about?
So that is the second commonest reason of the commonest presentation of cancer colon.
Yeah.
But not the problem is in our population, in my practice, what I notice when you have a
Mm.
rectal bleeding, most people tend to think it is a hemorrhoids. Of course,
Yeah.
hemorrhoid is one of the commonest reason for rectal bleeding.
Yeah.
But before we say it's hemorrhoid, we must find out whether there are other causes for the bleeding first. For example, polyp, and of course, we don't want to miss colon or rectal cancer.
Mm. Mm.
So any rectal bleeding need further investigation in terms of doing a endoscopy. So
Okay.
we cannot just say rectal bleeding is equivalent to hemorrhoid. No, we must look for other causes, especially
Mm.
must rule out colon cancer.
Okay. Doctor, we're going to be talking later about endoscopy and colonoscopy, right?
Yes, yes.
Okay. All right. We'll just get to that later. That's under treatment. Okay. Primary care. What is this?
This primary care is for the general practitioners in the clinic.
Mm. Mm.
So when they see patients with any perianal symptoms,
Yeah.
age more than 40, family history of colon cancer,
Yeah.
or all the symptoms that I mentioned just now, then they should refer for the specialist checkup lah. Even
Okay.
at the clinic level, we can do a digital examination of the anus to look for any tumor in the low rectum. This one
Mm.
more to the general practitioners.
Okay. If you can do that, then what is the need for scopes?
When you do the digital examination, we are only checking the very low part of the rectum.
I
You
see.
cannot see the other part because colon is around 2 meters long.
Mm.
So this 2 meter long is only accessible by doing scope. So just at the clinic level,
Mm.
we cannot assess the whole length of the colon.
Right. Okay. Doctor, in the 2 meters of this colon, at which point is the commonest area that colon cancer usually happens?
And the commonest is the lower part. I just now I mentioned rectum, which
Mm.
is from the anus where you pass motion around 15 cm long. That is the
Okay.
rectum, and also the left part of the colon, maybe up
Yeah.
to 35-40 centimeter from the anus. It's more on the
Okay.
left side of the body.
All right.
Uh,
Got it.
so this also for our GP friends to refer cases. Those
Mm.
more than 40 years old, rectal
Yeah.
bleeding, bowel
Mm.
habit,
Okay.
they should refer to the specialist for further assessment.
All right.
Can go to the next slide.
Screening. Okay. We have.
So for the our population, I think important thing is screening lah. Screening
Mm.
means when you have a symptoms, we go and see the doctor for further
Right.
checkup. It's not
Right.
considered screening. Screening means when you have no symptom, you're healthy,
Mm.
and then you go for checkup. Is considered screening.
Yeah.
Why we insist on this? Because when we detect the cancer early, the outcome is better.
Mm-mm.
Better still, we detect before it becomes cancer.
Yeah.
Because colon cancer always comes from polyp. The polyp is
Yeah.
it grows and grows and grows, become cancer. So
I see.
sometimes when we do screening, we
Mm.
detect the polyp and remove it, so it eliminates the risk of it becoming cancer in the future.
Okay.
This is the
Doctor,
advice.
if you are found, when you do scopes, right, and then if you are found to have polyps in your colon and that is removed, how long after that would there be a possibility of the polyps growing again?
Depends on the type of the polyps. There are after we remove the polyp, we will send to the pathology.
Okay.
Pathologists, they
Mm.
will look at it and then they'll give us a report. So we
All
see the
right.
report and then we see the type of the polyp, whether it's a
Mm.
hypoplastic, adenoma, low grade, high grade.
Mm.
That determines the risk of them to develop the polyp again in the future. So
I
if it
see.
is a high grade polyp, it means
Mm.
higher risk to develop cancer in the future.
Yeah.
So we have to do the scope again, maybe in 1 year time. If it is not a dangerous polyp, then we can
Mm.
repeat the scope again after 3 to 5 years.
I see. Okay. All right. What is this picture about, yeah, doctor? The one that we're looking at. Ah, this one.
So these are
This is
some of the
polyp.
example of the polyps. Sometimes
Mm.
polyps can be bulging, like
Mm.
a small ball, but sometimes it
Yeah.
can be flat. So there are many types of the polyps which we can only detect during the endoscopy lah, colonoscopy.
Okay.
Okay. And at the moment, those above 40 years old, we do encourage to go for screening. Okay. And those above 40 years old, or when you have a family member with colon cancer, should go for
Mm.
screening. Or other diseases like Crohn's disease
Mm,
and
yeah.
also genetic syndromes in the family.
Yeah. Doctor,
These are
that is if a person has all these risk factors that you mentioned earlier. But what about those who just have colon cancer randomly? You mentioned that the 20-year-old patient that you had earlier, right? So for those who are worried that they may have colon cancer regardless of risk factors, would you advise them going for health screenings as well?
Those more than 40 years old, I advise them to do so.
Yeah, but
Uh,
if they're younger, because it does happen to young people.
Less than 40 years old is up to the individual. If they are very concerned, they can still go for it. Because this screening is not only doing the endoscopy. Endoscopy is an invasive procedure. So we have
Yeah.
other tests, which I will show the pictures later in the slides,
Okay. All
which
right.
we can, it's very easy to do the test at home.
Oh, a test at home.
Yes, yes.
That's new one. Okay. All right.
And it's cheap. Next slide. So
Fecal.
these are the tests.
Hmm.
So it's called a fecal occult blood test.
This is the
Basically,
one that you do at home. DIY. DIY blood
this is
test.
DIY. This is
Wow.
DIY.
Okay.
Basically, what we do, we look
Hmm.
for blood in the feces, in the stool.
Okay. Okay.
Uh, because sometimes the blood is not visible to our naked eyes.
Yeah.
It's only microscopically seen.
Right.
So what these tests do basically, next slide. Basically, after you go to the toilet,
Hmm.
you just need to take some sample from the stool randomly, maybe 6 or 7 area,
Hmm.
and then next slide, and then just stain the paper that will be given. It comes in a box. This
Okay.
test is called the fecal occult blood test. Occult means something that we cannot see with the naked eye. So we
So
just
this
take
kit you can, where can you find this kit in the pharmacy or at the
in
hospital?
pharmacy, even in hospital, even
Hmm.
the patient they can buy themselves.
Okay.
So you just buy
How much detection? What if we are looking at the kesan lah? How much can this type of screening detect? Is it?
it is quite this when you do this screening, it doesn't tell whether you have cancer or not. It only
Okay.
tells that your stool got some blood.
Oh, I see. I
In
see.
a
Okay.
normal stool, there shouldn't be blood at all.
Okay. So
So
it is
when you
not
do,
about. This is not actually to detect cancer. This is only to detect blood in your stool,
blood in the stool.
regardless of whatever is causing it lah.
Yes, yes.
I see. Okay. Okay.
So in a normal stool, there shouldn't be any blood at all.
Yeah. Okay.
Same like in urine. So when you have the blood, there must be a reason behind it. So once this test is positive,
Yeah.
then the next is to do the endoscopy.
Okay.
From the endoscopy, we will find out the reason for the blood in the stool.
Okay, but doctor, one symptom of colon cancer is stools with blood. That one is memang 100%. That means if you have colon cancer, definitely your stool will have blood on it.
Not necessary. Maybe around 30-40 patients only will have the stool in the blood. So as I mentioned, if they have no stool in the blood, but they have other symptoms like alternate bowel habit,
Yeah.
abdominal pain, losing weight, then they still should go for endoscopy, even though there is
Okay.
no blood. So not everybody will have blood in their stool.
Okay, yeah. The reason I asked was because if we are looking at this kit, and some people may think that this kit is it is something that you can use at home, and if you find blood, then you may have cancer. But there's a chance also that you won't find any blood, but you may also have cancer.
Yes, yes.
Okay, all right, got it. Okay, let's take a look at the next slide.
Maybe next slide. Next slide. Next slide. Next slide. Sorry. So just now, the test I showed just now is a bit of old test.
Mm.
This immunochemical fecal occult blood test, called IFOBT. This is the latest, what you call model lah.
Yeah.
So the first test, there are many do's and don'ts before we do the test. But for this test, there is no do and don'ts. You can just use the test your stool anytime,
Okay.
and it will show whether you have blood in the stool. Okay.
Okay.
Next slide. So this is how the kit look like. It comes in a box where you fill up the personal information there. Next.
This is over the counter?
This is over the counter. You can buy from the hospital or buy from pharmacy and just do yourself at home.
How much, doctor? I mean, on average, how much would something like this cost?
It's very cheap lah. Probably not even 10 ringgit lah.
Oh, that's cheap. Okay.
Last time during one of our campaign, we even distributed free at hospital.
Oh, I see. I see. And you use it only once?
Pardon?
And how many times do you have to carry out this test on yourself at home? The kit is for duration? One time only. Okay.
One time only. And next slide, please. So you just take a few samples from the stool. Only to take out the whole chunk of stool, and then put in the what do you call? Next slide. Put in the bottle there, and sorry, once you done this, you have to send it to the hospital.
Oh, I see.
You have to send it to the hospital for the lab lah, to check, and then the lab will inform you whether we have the blood in the stool or not. But the process to take the sample is very easy. So you don't need to come to the hospital to do it or not. You can just do in the hospital, then send to our lab for further, and then we will let you know whether it is positive or negative.
This is actually a very convenient way of doing screening. Also because, we are going through MCO now and people are quite reluctant to go to the hospital. But when you do something like this, it's as if telehealth, which we do have. Colombia Asia does have telehealth. So this is akin to that because you do the test at home, you send it to the hospital, you don't have to go to the hospital yourself. And then the hospital will contact you if there is something to be worried about.
Yes.
Okay, doable. What is this, doctor?
This is basically how the kit look like. So it's like a pregnancy test. So if you see a two bars there, that means there is blood in the stool.
Okay. Wow, doctor, we've got quite a few questions here. So let's just see how many more slides do we have before we take the questions?
Maybe we can go to the next slide. Going to finish, I think.
Okay. All right.
So this is how we do so if the screening is positive for blood, the next step is to do a colonoscopy. Okay. Basically, it's like a flexible camera. We insert through the anus. Okay. And we will go through the entire length of the colon.
Yeah. So under general anesthetic?
This is just under sedation. No need general anesthesia.
Okay.
The procedure takes around 15 minutes only. So let's say we find a polyp, then we will remove the polyp endoscopically during the endoscope. So if we leave this polyp behind, these are the polyps that in future, in years to come, it becomes cancer.
It grows very slowly, doctor. Like if we see one tiny, okay, we're looking at the pictures, right? The first picture from the left, bottom row.
Okay.
That looks small. So something like this, how long will it take for it to grow?
Depends on that's why the HP is very important. Let's say the HP is a high grade dysplasia, we call it, then it can grow to become cancer very fast. If it is a low grade polyp, then probably it will take years before becoming a cancer.
Okay. So an aggressive polyps is 1 year. Are we talking about that, or maybe a few months?
Yes. Okay. Within 1 year, aggressive polyp, yeah. Okay, these are
And what
the
is
some of the genetic cancers. Genetic type of colon cancer, they develop the cancer very early in the stage lah, early
yeah,
in the age. Even
yeah.
teenagers get it, whereby the whole colon is full with polyps. But this is quite rare,
Oh my
rare. It's not
goodness.
common, it's rare.
Yeah.
Okay, next slide.
The whole colon is full of polyps, my goodness.
So
Okay.
other risk
So it looks
factors
like
are
skin disease.
colitis. Next
Mm.
slide. Okay, and just to introduce the laparoscopic surgery,
Mm.
let's say we found out it's cancer. So what we do? Definitely you will need surgery.
Yeah.
And nowadays we have the laparoscopic surgery or keyhole surgery, whereby
Yeah.
we do surgery using a small holes. So
Okay.
the advantage of laparoscopic surgery is less pain, faster
Mm.
recovery, and can back to work
Yeah.
faster. Okay.
So this is your specialty, doctor? Colorectal surgery?
This is my specialty, yes.
Okay. All right. It's good to note because we may have some audience there who are looking for this kind of help lah. So you can always call Columbia Asia Hospital Cheras and look for Dr. Veya. Okay. Faster
Okay.
recovery, less pain. Is this the after effects of the surgery?
These are the advantages of the laparoscopic
I
colorectal
see.
surgery. Yeah.
All right. Okay, doctor. If yay, done. That was very good, doctor, and very interesting as well. Very
Okay.
informative. Okay, let's quickly take some questions. I'm not sure whether we have enough time to address everybody's questions, but okay, let's just take a look. Yeah, there is one question from Miss Nabila Rahim. Hi, doctor. I like eating spicy foods. Am I at a higher risk to get colon cancer? That's a very good question on behalf of all Malaysians. Silakan, doctor.
Spicy food. There is no real evidence to say that spicy food is associated with colon cancer lah.
Mm.
It is, I will say, a mythos in Malaysia. Malaysians, they like to associate spicy food with everything, with gastric, with hemorrhoid, with cancer. But scientifically, there is no proven evidence to say that
Okay.
spicy food causes a colon cancer.
All right, good. Okay, there's a question here by Miss Ira Azman. What are the tests that we should do for detecting colorectal cancer? I think we addressed that. Do you want to add anything else to your answer earlier?
The easiest test, as I say, is doing the fecal occult blood test.
Yeah.
But the best way is to do an endoscopy. That's the best way.
Endoscopy together with colonoscopy, or just endoscopy?
Colonoscopy, I mean. Colonoscopy.
Together lah.
Together.
Up and down. Okay. All right. Miss Lydia Warprick, she has a question here. Is the blood from internal bleeding? Is there blood from internal bleeding in the intestines? That's why it's in the stool.
Yeah, the blood in the stool is because of bleeding from the polyp or tumor, which is from the inside the intestine. Either the small intestine or large intestine. If the colon cancer, it is from the cancer. When the stool touches the cancer, the blood from the cancer sticks to the stool. So when you pass out the stool, you can see blood in the stool. It is from
If the
inside.
cancer is bloody lah, but is it with blood all the time, or there are also cancers that do bleed?
If the cancer is bloody, if not a bloody cancer, you don't get the blood in the stool.
Okay. Bloody cancer. Let's just put it that way. Okay. There's one question by Miss Cahaya Kejayaan. Wow, fantastic name. Hi, doctor. Will constipation lead to colon cancer or not?
Constipation definitely a risk factor because when you're constipated, the stool stays in the colon longer. So when the stool colon longer, there is toxin, bacteria, everything. So the contact with the surface of the colonic mucosa longer. So of course there will be a higher risk to get the colon cancer lah. So we have to make sure we are not constipated. At least pass stool, preferably once daily.
Once a day.
Yeah.
Okay. Hope that answers your question, Puan Syahaya. Okay, Ms. Guan Yap is asking, how can we clean our colon? Sometimes we do have muddy and sticky poo-poo. I'm worried that this kind of poo will continue to stick on our colon's wall and eventually become cancerous.
First, we must drink a lot of water,
Hmm.
at least 1.5 to 2 liter water a day.
Okay.
Take more vegetables, green vegetables,
2
local
liters
fruit.
of water, that's how many glasses is that? On average, lebih kurang. 8.
8 glasses a day.
Okay.
Take more green vegetables, local fruits, banana, papaya, and once in a while we can do colon cleansing also. Maybe
Yes,
every
I was going to ask you about that.
3 to 6 months. Colon cleansing is sometime when we do before we do the colonoscopy, we ask the patient to drink the colonic cleansing water.
Yeah. Yeah,
Okay, there
horrible.
are many types lah. Normally in the hospital we use Fortrans. So that basically cleans the bowel, take out all the stool toxin from the bowel out. So when you
Okay.
do the colonoscopy, we can take a look at the clean colon. So
Yeah.
we can do that also, but we cannot do that too regularly. Maybe every 3 to 6 months, we can do that to clean the colon.
Every 3 to 6 months. So you mean the solution that the hospital gives you in order for you, before you do the colonoscopy, you can actually just take it every 3 to 6 months if you
Every
are worried about
yes,
dirty colon lah,
yes.
without you going for colonoscopy. Just minum macam tu saja.
Yes, without going also you can take just to clean the colon.
Oh, I see.
But
Yeah.
if it's a
Understand.
habit like you take it every week, that is not advisable.
Yeah lah,
Maybe
yeah.
every 6 months we can take that just to clean up the colon. Yeah, can.
You can buy the solution at the hospital. Is it something that is easily
It's easily
accessible?
available in pharmacy. Pharmacy
What do you call
hospital.
it? I mean, not the brand. What do you call that solution to cleanse the colon?
It is bowel cleansing material. There are many brands,
Okay.
but in the hospital we use the brand called Fortrans.
Okay.
Fortrans. Yeah, Fortrans.
All right. Okay, that's good to know. At least now we can. Anyone who has a problem, and if you are worried, you can just do your own colon cleansing. Okay. We've got 7 more minutes before you wrap up. Muhammad Nasrul Sharif. Okay. His question is, hi doctor. Did colon cancer only happens to male?
No, colon cancer happens to everybody, even male, female, young people, old
Children?
people.
What about children?
Even children can happen, especially they have a strong family history. Some of the cancer they are genetically determined,
Yeah.
so even children develop the cancer. So in some cases,
Yeah.
what we do before the cancer develop, we remove the colon. These are in certain genetic related colon cancers lah. We call it the FAP, familial adenomatous polyposis. So these are
Okay.
genetic colon cancer. So what we do, we know it's going to 100% develop cancer. So before the cancer happens, we remove the colon.
Okay.
Yeah.
And if that happens, the function of the digestive system, would that still be able to run smoothly before
What
surgery?
happens,
Just
the
like
function will be taken over by the small bowel. We have a small bowel which is very long, 4-5 meters.
I see.
So the function will be eventually taken over by the small bowel.
Oh, doctor, forgot to ask you just now about the screenings that you mentioned, including that last resort, which is not last resort to screening, the surgery. The surgery kan, okay. All these are available at Malaysia Hospital Cheras, right?
It's available here. We offer the service.
Okay. What are the side effects? Is there anything that we should be worried about?
Side effect of these?
Side effects of the kit that you need to do at home, atau side effects of scope?
No side effect, minimal side effect. Even
Okay. So
very low risk of complications.
Kalau laparoscopic surgery tu side effects pun nothing much to worry about lah, I guess.
That one depends on the type of surgery we are doing. That one we need to counsel on a patient to patient basis lah.
Okay. All right, got it. Okay, we'll take one last question from Ms. Gloria Jackson. I saw a video that promotes their product claiming it can clean our colon, wash away all the toxic. It's true. We just spoke about this earlier. Have you seen any? Have you heard of anything like this? It does sound like what we discussed just now.
I'm sure there are many products in the market claiming to cleanse the colon, but how
Yeah,
effective they are, I cannot watch for them lah.
yeah,
So
yeah,
I can only tell from my practice at the hospital the kind of cleansing that we use before we do colonoscopy, like cold
yeah,
clean and trans, which
yeah,
are quite safe products that we use.
yeah.
And it cleans the colon quite well, because when you do the colonoscopy, we can see the colon
Clear
very
lah.
clean. So about the other products out there, I suppose you better get an expert opinion before consuming the product.
Yeah, yeah. Okay. Maybe a prescription would be better lah than
Doctor's prescription is
sleep seal.
better lah.
Yeah, yeah. Doctor, have you heard of coffee enema?
I've heard of it. In
Yeah.
fact, I got one patient who came after doing the coffee enema and developed some complications.
Oh my God.
So
Yeah. So you
I don't
wouldn't
know.
recommend that?
Pardon?
That's actually a holistic something. It's considered alternative, right?
It's an alternative medicine, but how good it
Yeah.
is, what are the benefit and complication? Uh, I need to do more research on that lah.
Yeah, yeah. But it wouldn't be something that you recommend lah at the moment.
At the moment, something that I won't recommend lah.
Yes. Okay. All right. Let's just take it as is. Okay, doctor. Thank you so much. We have answered all the questions that we have received from all our viewers. Thank you so much for making this interactive, ladies and gentlemen.
Thank you.
And thank you so much, Dr. Vina, because this has been a very interesting session. Okay, ladies and gentlemen, that was Dr. Venayagamurthy Kanisan, who is the consultant general and colorectal surgeon from Malaysia Hospital Cheras. If you've got if you'd like to see Dr. Vina, disappeared already. If you'd like to have an appointment with him, you can always call the hospital, or you can check out our website at www.colombiaasia.com. Okay, that's all the time that we have for today. See you again in another episode of Doctors Go Live.